Hey, Dr. David here. So, what is wrong with our current approach towards sickle cell disease? I'm not just talking about Nigeria, I'm talking about the rest of the world. Uh, I hate to use the word wrong, but let's go with inadequate because whatever approach or strategy that will work is one that has to work in Nigeria. Why? Because Nigeria is grand central station for sickle cell disease throughout the world. We have the most number of patients by far. We have the most severe cases by far. So it has to work in an environment that is lacking in the basic, almost all basic fundamental things. So we don't have access to healthcare like you in the Western world would have. We don't have access to running water, for example, which is extremely important. Clean water is extremely important for children with sickle cell disease. Uh, the environment is a little more hostile. We're dealing with tropical diseases like malaria and typhoid and all these different things, even on normal hygienic things that you take for granted, electricity, I mentioned water already. These are things that are not readily available. So whatever approach for sickle cell disease has to be one that can easily be applied in remote areas of countries like Nigeria. So that kind of rules out gene therapy using the CRISPR and all that. Kind of rules out bone marrow transplant, which is the gold standard right now for treatment of sickle cell disease. It even rules out hydroxyurea, which is the most successful drug for treating sickle cell disease. Well, why? Because hydroxyurea works for a lot of patients. A lot of patients it doesn't. But the key thing with hydroxyurea is that you have to have a qualified physician, usually a hematologist, who knows what they're doing. They have to be able to monitor, they have to carefully prescribe for that particular child and that particular age and circumstances. In other words, you can't just willy-nilly hand out hydroxyurea to patients because there's a huge, huge risk of damage from aplastic anemia. Aplastic anemia simply means that the bone marrow shuts down and refuses to produce red blood cells altogether. And that's bad for any human being. It's especially bad for someone with sickle cell disease. So hydroxyurea has to be used very, very cautiously. You can't afford that in remote areas. And then besides, it's a little bit more expensive. And also, there are people who react to it, not just aplastic anemia, not just the risk of aplastic anemia, but there are people who actually react to hydroxyurea. So you need something that is safe, that it works effectively, and that is simple to apply, simple to administer. In other words, the parents who are illiterate should be able to know how to use this. And also it has to be cost effective, AKA dirt cheap. When it comes down to it, there are a few suggestions that we have for that, and we found that they really work. So stay tuned, and we will continually give you information about